If we have around 2 crore of the Indian population who are treated with COVID, we will end up with at least 1 crore of them who will have diabetes in the near future.
There is actually no role of steroids in mild disease whatsoever.
What are the patients supposed to do if doctors are prescribing these or not able to? They cannot find remdesivir, they cannot afford to pay that much, or and does this medication really help as much? And if they don't find it, what are their options?
See, first of all, you must understand that in COVID-19, there are very few limitations as to the modality of treatments are concerned. We are not left with much of the options. Not only the Western world, US, UK, European Union, as well as the Far East, we have all flip-flopped as regards to what is the modality of treatment. A stage came in when they said that remdesivir was doing wonders. Then they came up and they said that remdesivir is not, decreasing the mortality rate. Then they came up with tocilizumab, which did the wonders. Then they said tocilizumab is of no use. Then now again they have come up that tocilizumab is of use. They said plasma was of use, which now nobody is using plasma. So everybody is going through what is his perception and what is his experience as regards to a patient. What I want to lay stress on, that since COVID has evolved now over a period of time, over a year, we all have also matured and experienced ourselves. So the blunders that we committed in the first surge of last year, I think we should avoid those blunders committing now. And that is why I always recommend that you should have a proper clinical evaluation along with the array of blood tests that you are doing and your HRCT, chest, etc., to decide what is the best treatment for this patient and whether this patient is going to go on a ventilator or not. So you should nip it in the bud. Now somebody might say, no, I disagree. Well, that's his perception. But what I have realized is in the last 4 months, I'm not talking about this surge which has taken place in the last 15 days. In the last 4 months, my patients have gone back home on the 5th day or 6th day. Now, in this, I will also attribute one of the reasons because we did prescribe a lot of steroids initially. But all those patients who were discharged after taking steroids and blood thinners, they have come back with multiple problems 3 months down the road, 6 months down the road. And unfortunately, because the medical fraternity has been harping about steroids, in every nook and corner of the city, in the villages, in the satellite townships, etc., even the family practitioners have been pumping in steroids day in and day out. I would like people to refrain from this because a time will come when all these patients will land up 6 months down the road or a year down the road with diabetes. Steroids is to be administered. It's a life-saving drug. But you have to be very judicious and diligent enough to initiate the treatment with steroids, and you should know the limitations and when to stop. What is happening is now steroids has become a part and parcel of every prescription, whether it is domiciliary or whether it is in the hospital. So I would beg to differ with others in regarding this. And it has been my experience that all these patients, if you can avoid steroids for them, that is the best thing that would happen to them. Otherwise, if we have around 2 crore of the Indian population who are treated with COVID, we will end up with at least 1 crore of them who will have diabetes in the near future. I'm sorry to say this. Take it with a pinch of salt.
Dr. Thadhani, please carry on. What do you feel?
Yes, I
Do you
agree
agree?
with Yes, I agree with sir completely. There is actually no role of steroids in mild disease whatsoever. In moderate, we can use inhalational steroids like budesonide nebulization, for example, in preference to oral steroids so that there are less systemic side effects. In severe COVID, we will definitely have to use oral steroids, but we should try to taper them off as quickly as possible. So yes, I completely agree with sir that that steroid use should be very very judicious. And also the big fear for us now is mucormycosis. It's a type of very dangerous fungal infection which kind of eats up the tissues, and it's quite lethal actually. It's very almost or near impossible to cure it. And many of the patients who've been given long-term steroids or given tocilizumab come with mucormycosis, and it is a lethal disease. It's like out of the frying pan and into the fire situation. So we need to be very very judicious as to whom we are going to be giving. If we are very sure that the person is not likely to survive without it, we of course must use it. But there are certain risks and consequences involved which we need to be very very careful of.